Hi, I'm Elizabeth Sullivan. I'm one of the Admiral nurses working on the Dementia UK helpline. Today I'm going to talk to you a little bit around assessment and diagnosis and how that can be a bit of a waiting game to happen. So my agenda for today is kind of talking around empowering pre-assessment and diagnosis, maintaining health and well-being while waiting for that assessment. I'll go through two types of frequent questions I get asked when I'm on the helpline, advice offered to people if they're being a little bit resistive or declining to go to the GP, kind of maintaining health and well-being whilst waiting for an assessment, things a carer can do to help that person before they get that assessment, and things individuals themselves can do and carers to encourage them to do, and what support might be needed to go along with that. So, two types of frequent questions I get asked on the helpline. So person is being resistive to get a diagnosis. What do they do while they're waiting? The person is open to having that memory assessment. They're on the waiting list for the assessment, but the waiting is really long. What do they do while waiting? How can they help? In both cases, the advice is very similar regarding maintaining the health and well-being. However, how to get someone to the assessment or to agree consent to being visited by the GP to get assessment differs. Advice I would offer if a person is being resistive. So to start off, reassurance for the carer that this is common for people to not want to go for their memory. They worry about losing their independence, giving up driving, and the most common one is they think we're going to put them into a care home. So there are alternative ways that I can suggest to try and encourage people to go to the GP. Sometimes not talking about the memory part of it at all can be helpful. So speak to them about physical issues that perhaps are going on for people, and when's the last time they had the medication reviewed, when's the last time they had an MOT with the GP, are both quite empowering for people to think about and perhaps will go. If someone is still saying they're not going for the GP for anything, you can ring GP and have a chat with GP if you've got consent to share information with them. If you haven't got consent to share information, you can still ring the GP, but they can't discuss any of their care needs of that person with you, but they can document that information so it's there if that person goes to the doctor's practice. Capacity and assessment. So very often people say that they're not going, they don't realise, they're in denial. And I have to explain to them that while someone is deemed to have capacity still, they have all rights to make an unwise decision, whether that be right or wrong, an unwise decision. So that capacity, I have to say, needs assessing. That can be done by any healthcare professional that's involved in that person's care, such as a social worker. Really important communication with that person, so reassuring people, using non-judgmental language, so making them feel at ease and it's okay, and that, you know, if there is something going on, it can be treated and managed quickly. Unfortunately, at times, I have to tell people that sometimes it is just a waiting game for something to happen, and it unfortunately be took out of that person's hands for intervention to be completed. Maintaining health and well-being whilst waiting for an assessment. So we are really aware that in some areas the waiting lists are very long for assessment and diagnosis. And again, what do they do while they're waiting? How can they encourage them? How should they be approaching that relative or friend? There are steps we can take whilst we're waiting for an assessment to try and help keep things on an even keel. Um, so things carers can do. So advice would be, keep a symptom diary of what's happening for that person you suspect has that memory loss. And then that's a really good information for when you see that healthcare professional to talk about what's been happening and giving examples of what's been happening. I think if people are a little bit more advanced, perhaps in their journey, that starting a life story book for people to talk about their history, activities they like, relatives they have contact with, and that can be put in place to help people know about that person. Always, again, validation, empower, communication. So always validate that you'll know how people are feeling. So they don't want to go to the GP, you understand that. And for the example of the physical things, there's something physical going on, so that could empower them to make that okay, it could be something to do with my physical health, and I'll go. So that communication between each other is really important, because if that breaks down, then you've got nowhere to go really. So that's really a positive thing. And the carers quite often forget is looking after their own physical and emotional well-being as a carer. Um, Obviously, we don't want carers to get burnt out. They want to care for their relatives all the time, but it is stressful and tiring, especially if you're doing that on your own without any other healthcare professionals involved. Sometimes we have to say in the nicest of way that if you're burnt out, then you're not much support for your relative, for them to realise that perhaps it's time to take a step back and look at help. So things individuals can do, and carers can encourage individuals to do, the things we all know about. So physical activity, just a walk each day, just going out in your garden, is really good. We all know physical activity is good, and it's good for our happy hormones, and that could be a stressful time for someone. So it could take their minds off kind of that worry. Eating healthy, as we all know, we all could eat healthier more. Smoking, so try and cut down on smoking if they are smoking. It has those kind of cardiovascular elements to it. Reducing your alcohol intake. Some people will use it as a coping mechanism. We all know it can affect mood as well the next day if people drink too much. Encourage them to exercise their mind, look at those activities that are meaningful to someone each day. Things like word searches, television programs, getting out and about, doing your shopping, all those things we take for granted every day, to continue to do as much as possible. Sleep hygiene, very important. As we all know, when we've not had enough sleep at night, we ourselves get quite grumpy. For that person that's perhaps got that memory loss, it enhances that. So to sleep really well means you have a better day the next day. And effective management of your long-term conditions. So things like diabetes, vitamins, to maintain that and keep in touch with your GP to optimize that is really important. So what support might be needed? So I've got lots of pictures here, just giving examples of lots of different things. So practical support, help going to and from those appointments to keep your physical health maintained. is support people might need, and whether that's a relative helping, or if they're busy, suggesting community transport, community buses to see if that can help them. Emotional support, so looking after their emotional health and well-being. Clinical support, this again relating to anything that is related to your health, which you may need to keep up to date with your GP. And social support, it's really important keeping connections to families and friends and the community, so people don't get lonely, don't start isolating. So encouraging your people to keep those up and going is really, really important. And that's the last of my slides. Thank you very much for listening. I hope you've enjoyed the session. Thank you.